You're listening to the WCEN podcast. Hello everybody, I hope you're doing really well today. My name is Peaks and you're listening to the WCEN podcast. Now, if you're just tuning in for the first time, welcome. The reason for this podcast show is to keep the communities and multi-faith networks informed on services during this pandemic and UK lockdown. We're just trying to keep everybody's spirits uplifted and sharing stories and also services that people can access during this time. It's really important that people know that there's resources out there. So we're going to be speaking to various people who have experience. We're going to be speaking to people in the NHS. We're going to be speaking to people who are faith leaders, community leaders, social prescribers, whoever it is that's got something to offer, then we're going to be speaking to them on this platform. So I hope you're going to find this really useful information here. And so today on the podcast, we are going to be talking to Dr Mohan Sekeram. He's a GP in Merton and a clinical lead at NHS South West London, a leading social prescriber for Wandsworth and Merton, and highlighting how non-medical intervention can help support an individual and a community built resilience. So Dr Mohan, are you there?
Yes, I'm here. Hello.
Okay, how are you today?
I'm very well. And yourself?
I'm well, thank you. Actually, it's quite nice. You sound quite upbeat.
Yes,
yeah. We've spoken to a lot of people during this podcast, and a lot of people are obviously, like, oh, it's tough work, but yeah. But you sound really upbeat, so that's good. It's obviously understandable, but yeah. All right, so I've just given everybody a bit of an introduction about who you are, but it's great to obviously hear it from yourself. So it'd be good if you could tell us a little bit about who you are, your background, maybe your heritage, and kind of what's leading you into the type of work that you do just before, obviously, the lockdown. So if you could just give us a little description, that'd be great. Thanks.
Of course. So I'm Dr Mohan Sekeram. I'm a GP in east of Merton, so east of the borough, and a practice called Wideway Medical Practice. My heritage is Sri Lankan, and I've been a GP since 2008. I'm also the clinical lead for social prescribing for Merton and Wandsworth CCG, for both boroughs, and I've been doing a bit of work in that respect. I'm also the locality lead for east of the boroughs at East Merton GP practice as well. That's me, and I do a lot of training. So I do education, teaching registrars to become fully fledged general GPs. Also working with training hubs, which also help with education with all our healthcare professionals in Merton to train. So I'm also sitting on the steering group for that to try and improve education across Merton. So that's me.
Wow, that's a lot of work.
Yeah.
So just for if you could give us a little bit more about, what brought you into that line? What was the inspiration behind it, or what kind of led you into this line of work?
So what got me into being a doctor initially? I've always wanted to be a doctor since I was younger. Certainly, there was a lot of friends and family were doctors as well, and so I went down that line. Once I had got some work shadowing and realised actually that's what I wanted to do. I qualified as a doctor in 2001. And did various different subjects or different topics in the hospital. So did a bit of orthopedics, bit of pediatrics, bit of medicine, and then thought actually I want to be a general practitioner. So did my exams for that and qualified in 2008. And so GP for 12 years now. And I'd have to say it's great. I absolutely love being a GP. I think you get to spend time with patients, you get to build relationships, and over time you get to see some real life stories of families and people unfold, and you get to see them through some good times, you get to see them through some bad times, and also family members, and that helps build your recollection or build a picture about what's really affecting a person. And often we think medicines or drugs may be the solution, but actually you look at some of the social implications which have affected a person's journey, and you realise actually there's some real social factors which have contributed to that. And being a GP and being a GP for 12 years, you see that happening. You think actually the reason why you're feeling low or feeling upset or feeling tired is because someone passed away last year, or you've just lost your job, or you have a relationship problem with someone I know also at the practice. So I think that's why general practice for me is very sort of unique, and you get to really building those relationships as people get older, and as I get older myself as well. And now it's very, very nice to help support people and use my knowledge I learned at medical school and my years of training to try and help support our community, and identify what resources exist out there. So I think that's how I've ended up where I have, and it's great. I get to meet some really inspirational people in our community. So people like Malik from Wandsworth Power Network, and some other members who really help. Some of the work they're doing, and it's really good or gratifying to help align what general practice does to what happens in the community, because I think we can really strengthen our community and build resilience and really empower it for generations to come.
I mean, you mentioned there Malik, so obviously he works for WCEN. And
Yes.
so if you could tell us, how did you come to hear about the work that WCEN does? They work with multi-faith communities, and also they do a lot of outreach work and community work and things like that as well. So how did you kind of come to hear about the work that they did?
Yeah. So I think everyone knows Malik in Wandsworth, and
He
also
works very
Merton as
hard,
well.
yeah.
Yeah, so you get around a bit. So I lead on social prescribing for the Wandsworth DCG, and so we were implementing the program in Wandsworth, and I'll give you a brief description around what social prescribing is.
Yes,
It's about
definitely.
so normally I kind of alluded to a bit in my introduction. So quite often a patient will see a GP with a medical problem or some kind of symptom like a headache, a rash, or feeling tired. And actually we may treat the symptom, which is the headache or the rash, but actually underlying that is their social issues. So things like homelessness, things like bereavement, things like education. And if we don't sort out that root cause problem, we often then won't treat that symptom. And so what social prescribing does, it identifies what that root cause problem is and tackles it head on. And so we have some link workers or social prescribers who work at the practice, and anyone who we know we think have not got a medical problem but actually got a social problem which needs tackling, we then refer them to the social prescriber, who then spends an hour with them trying to identify what their issues are. So that's a new, it's an NHS initiative which has been going on for the past few years, and that's been rolled out. So all the GP practices in Wandsworth and Merton will have a link worker, and across the country, to be fair, will also be having this. So a great resource for general practice, and how I bumped into Malik, because we're looking at a model where we have these navigators or link workers in practice, but actually it would be good to have these navigators or link workers in the community, working in faith groups which target a different group. So I think we often sort of attract or identify patients who come to see the GP, and they're often a certain few, and quite often the patients or the isolated we don't get to reach out to, and they're the ones we want to kind of grab. And having spoken to Malik on a number of occasions, certainly from the BME community, and other isolated groups as well, they often don't identify themselves as being an issue, or don't want to make any trouble, or they kind of don't want to seek help when they may need it. And so we need to outreach to those communities and help get the education where it's going to be reached the most. So things having faith groups being identified as these link workers or supports, train them up to do health checks, train them up to give support to congregations or crowds, and say, look, actually, we need to help ourselves, or help with our health, help with pick up any underlying health issues while they're out in the community before it becomes too late. So I think we've had some really interesting conversations about how we can make that work. And I think we want to try and not medicalize everything, and not wait until we get things too late. We want to try and identify any problems or medical problems earlier on, while it's at the treatable stage, or while we can reverse it. So that's a really exciting project which we're looking at doing in Wandsworth and other areas, but COVID sort of put things on hold, but I think hopefully we can still work towards that, and certainly there's other schemes which have been able to help us empower our networks or our communities.
Yeah, I mean, with obviously this lockdown and everything that's happened, I think I don't know what your take is on it. The fact that organisations like WCEN and all the other multi-faith networks who are kind of under that umbrella and who have been working together and trying to have access to services for those hard to reach people, like you say, the BME people, and having the work before this lockdown kind of happened and saying, come in here, we're training people up and all that kind of stuff to kind of get you before you get to that crisis point and stuff.
Yes.
How important do you think working with organizations and having like those, that's obviously within the Wandsworth kind of area and stuff. How important do you think it is, and nobody ever expected anything like this to happen, that they already started putting things like that in place? And how does that kind of help you with social subscribing? That the fact that things like that are going on where communities are empowering themselves to get those harder to reach or BME members of the community.
Yeah, no, definitely. I think, I mean, you hit the nail on the head. I think, regardless of where you are, Wandsworth, Merton, Scunthorpe, Bradford, I think every community will have its own sort of niche, its own environment, its own requirements, and its own assets. And we need to identify what those assets are in a community and build on that. I think we often try and find a gap in a community and go, let's plug that gap. And often that's a external resource which comes along, plugs the gap, and then as soon as funding dries up, or as soon as the interest goes, then that external resource then leaves, and then you're left with this gap again. Whereas I think if you can find what your asset is in your own community and say, look, why don't we grow what we've got, and hopefully that will help plug these gaps and make it sustainable, empower it, and help what we need to do to strengthen the resilience in our community. So I think it's really powerful to do that, and I think quite often patients or individuals or clients or members of the community don't want to go and see a doctor because they're just scared, terrified, or they just don't understand why, they don't get what their problem is, and there's also health inequalities. So clients from a more socially deprived area won't be aware of what they've got, and so they'll often present late. So I think if we can empower our community, say, look, if you do have this, a nasty looking rash or lesion, or if you have a nasty cough, or if you're having certain symptoms, or you're losing a lot of weight, rather than wait until it gets a lot worse, we need to see these people a lot sooner, a lot earlier. So I think it's really important to get the message across. And I think with close-knit communities, we can all support each other within a crisis, without a crisis, and actually really identify our resource and get the most from what we've got around us. So I think it's really, really powerful. And I think even the social prescribing work which I'm involved in, is identifying patients who don't have a medical problem and actually reallocate them to the community and say, look, your headache and rash and tiredness is because you need to do more exercise, or you need to maybe do some yoga, or you need to spend some time at the community. And now we're moving that resource from the practice into the community. So which is where it should be, but it needs the adequate funding and adequate resourcing. Otherwise, what will happen is you'll burn up all the resources available, and then then we'll have a bottleneck and things will happen. So I think it's important to identify the need, identify what your assets are, build and nourish that, and actually target those hard to reach groups by really supporting the people who are really going to make a difference.
I mean, so this sounds like a really good service. I mean, how does somebody find out more about social prescribing? How do they access the service and get more into it?
Yeah. So with social prescribing, it's been going on for years, decades, and many communities will be familiar with this, and lots of voluntary agencies will have a link worker or equivalent where patients or clients can self-refer themselves. What's different about this movement is that these link workers are moving into the practice, so you've actually got them sitting next door to a GP. So if I'm in my consultation room with a patient, and I might say, look, I've identified that you don't have a medical need here, but I think you need to spend time talking through your problems with a social prescriber. before I would have sent them out the practice down the road. They would have gone to the nearest voluntary sector. As soon as you leave as soon as a patient leaves the practice, you often then lose them. They often then go and find something, which they think is more important to do, shopping, picking up some kids or whatever.
Yeah.
But I think having it all under one roof and having the social prescriber next door, hand in hand, integrated with the GP, I can say, look, I've got Bob next door. He'll spend an hour with you, talking through some of the issues, and he'll know what's out in the community to help you. So I think that's the difference. But as I said, I think patients can either through their GP if they want the formal way, or identify it through their voluntary services or their networks, really, and really find out what these, how to get to the bottom of what their need is.
I mean, this is like 7 weeks now, I think, into the lockdown and everything, and as well as obviously this pandemic that's happening. There's also what's being brought to light as well is people who have have other health concerns, maybe diabetes or heart problems or whatever it may be, and they're kind of like not going in to say, okay, I've got these health problems, and they're kind of staying home because obviously they're self-isolating and thinking maybe they can't go in and get treatments and stuff. How is the NHS coping with that, or is there anything that you're seeing yourself that that you can maybe let people know that, okay, things are, you can still get help and stuff? What is it that you guys are seeing now firsthand in the front line, as they say?
Yeah, no. That's a really key question, actually. And I think during the lockdown, we've been telling people to stay at home, stay away, don't spread the infection, which is true to a certain extent. There's also a risk of shielded patients, and they make up 1.5 million of the population in the UK, and they are patients who do have pre-medical existing conditions who will be at high risk, and they unfortunately the advice has been that they should stay in their house for 12 weeks, and the local council will have a duty to give medications or get their medications and food to their house. So that's the shielded list. Now, certainly if you have a medical condition, unfortunately, if you're from a BME community, you do have a high risk of having, not getting COVID, but if you get COVID from suffering more ill effects. But it doesn't mean that you shouldn't seek medical attention, and that's really key, because when this all first started, the message was actually, don't stay at home. If you've got a medical condition, we'll speak to you on the phone. Now, as this has progressed, it's going on a long time, and 7 weeks you've mentioned there. Other medical conditions do exist. So people do have heart attack, people do have strokes, people do have cancers, and they don't just go away because of COVID. And COVID doesn't help treat these symptoms. And unfortunately, what we're seeing is we're not seeing as many patients or people coming and seeing their GP complaining of these conditions, and so we worry that these patients are underplaying their symptoms because they're worried about coming and seeing a GP or a healthcare professional about these symptoms, because they're worried about catching COVID, and therefore not doing themselves a service. So I think if you do have medical problems, please contact your GP, and because that's what they're there for. And medical conditions still do occur, so the NHS is still open, and we should really remember that, because what we do not want is to delay these presentations. There's been a reduction in children in particular presenting to hospital, and a lot of children are turning up very late when they're very unwell, and it's been much difficult to treat them because of that late presentation. And as I said, we often see patients who may have symptoms of cancer, and there's been a real drop of patients who we're seeing with that because patients aren't coming in. So if you do have any alarming symptoms, then please do seek some help.
Yeah, and I mean, if that does happen, what's the kind of situation? Because obviously, people are being told to stay home and whatever. But if they do need to come in, can someone take them in? Because there's incidents of people saying they're not allowed to go with a partner or this or that, and need somebody to, because obviously somebody may need help getting in and to stay with them and let the family know everything is okay. So if somebody does need to come in, what's the kind of situation, and can they have somebody accompany them and everything?
Is that in the GP practice or the hospital?
Or
both?
or both, because obviously so that people can understand what's the situation, if you can help out with some information on that.
Yeah, so there's a variety of ways to contact your GP, so your family doctor. So you can either do that through the phone, and we're able to then, and what we're doing now is a lot of GPs are calling patients back to then find out, how they can be helped, and if need be, they can do a video consulting, so they can speak to them through their phone and do a FaceTime type consultation. If it's still not clear what needs to be done, then they can come down and be seen. And when they come down to be seen, then obviously everyone wears the protective equipment, the PPE we call it, and we also give the patient a mask as well to minimise any risk of transfer of infection, both for the patient and also for us giving it to the patient. So there's certainly ways we're able to cope with that. There is a lot of stuff we can do with the phone, but there are stuff we can give advice on the phone and maybe arrange for some tests, a blood test, an X-ray, an ECG, etc., etc. So there's plenty which can be done in that respect. In terms of can they come in with a relative, they can come to the GP practice to be seen with their relative, but again they'll be wearing the PPE stuff if they need to be assessed. The question is whether they need to be assessed or not. The majority of times it may not be, but there's still quite a few where they will need to be assessed, and that's when we can make that conversation. Now, the problem arises, and I've been involved in a few cases where I've been around someone's house who's been very unwell 2 or 3 weeks ago, and they actually needed to go to hospital because their oxygen levels are quite low and they were breathing quite quickly, and they were very worried about going into hospital because actually they were from a BME background. They were an Asian lady who didn't speak any English, and she was terrified about going in to a hospital where unfortunately you can't take relatives in with you because there was the hospital is going to have COVID. They have wards with COVID patients on it, and wards with where COVID free, and if you then have a patient on a COVID ward and a relative goes in to see them, then there's a high chance that they'll then be a vector or a vehicle and be able to pass things on. So unfortunately, that's been a real barrier. So this elderly Asian lady who I went to see in her home, who I would have admitted to hospital previously, she didn't want to go into hospital and she wanted to stay at home and take her chances because of the fear of being in a ward with doctors, and being in unfamiliar surroundings. I mean, fortunately, she actually survived. She's still quite unwell, and she's recovering, but ever so slowly. But this is a real concern. There's no real solution to that. But I mean, that's what the COVID outbreak has brought. But patients who have non-COVID symptoms, I would urge those to seek medical attention because there's plenty which can be done with that before it gets to the point where it's quite hard to treat.
You mentioned obviously with the BME community earlier that it seems to be the number seems to be a higher risk of them catching this and maybe suffering fatalities from it. I mean, in terms of that and in terms of doctors, I mean, yourself is from BME and all these other doctors are saying they seem to be a higher risk. Can you shed some light on that and what's your experience and kind of take on this kind of situation?
Yeah, I mean, I can't shed much light on terms of why members of BME communities are affected more. And certainly, we look at some of the fatalities, and the majority are from a BME background. So I think it's even more important to consider that. So I think if we have any symptoms of COVID, or if you're feeling unwell in any way, that we do take this seriously and don't try and brush it off. And I think some of the cases where we have had fatalities, I think doctors have kind of been quite brave and just carried on and actually not put their health, as a priority. And I think, people are very guilty of that. And I think it's getting that education across that, look, you need to look after yourself, especially from our community, and look out for each other. I do believe that we're looking at risk assessments to try and help support members of the BME community, certainly in the workplace, and I think that's due to come out sort of in the next sort of few weeks or so, to see what the best guidance is. But in the interim, I think it's being aware of that and making sure that we don't downplay any symptoms.
Mm-hmm. And so basically, again, this is like gone into this for like 7 weeks now. This is quite a long time, and this is the first time that anybody's really experiencing this type of thing. What's one of maybe like something that's this has really highlighted for you, in terms of maybe the medical profession, about how yourself was prepared for it, maybe, or how community members are dealing with it? What's something that this has really highlighted for you?
Yeah, it's a good question. Well, how's it highlighted things for me? I mean, I think it's identified how fragile our human race is, and actually, we've got all this wonderful technology and we've advanced so much, but actually we've gone back to basics, haven't we? We're sort of in lockdown. We're cooking now. Everyone's cooking their own food. Restaurants are closed. We're actually having more of a family network because we are confined to our general group, and I think. We need to remember that to kind of probably climate change. We need to look after the climate, otherwise it's going to be disastrous for us later on. I think also from a medical perspective, it's fascinating how with all this medical advancement that we were not able to find, we're still working on a vaccine, although that will take some time for that. But actually, it's like flus of other generations, the Spanish flu, the plague, etc., etc., and these viruses can come along and do that. So we need to be prepared for this, and I think certainly we will, in future waves if there were to come, and certainly for the remainder of this one. I think what's been really empowering for me has been, or inspiring, has been how communities have come together, and that people have wanted to help each other in this time of need, and everyone's willing to help, drop medications, get food, and how we've kind of all abided by that, and all certainly clap for carers, which is going to be on in half an hour. Is a wonderful testament to that we all once we come out, we clap for all the frontline key workers, but also we're all in this together, and actually it's being that community resource for each other, and actually not that's often where we need our strength from, is actually not from anything special. It's actually those back to basics. What is in our community? How can we support each other? And we can do that by just looking what's on our doorstep. So that to me has been really empowering and humbling, actually, in terms of how resilient and how people have come together, and that's been really key for me.
I think from all the people we've spoken to doing this podcast series, everybody's really spoken about how the community is really kind of showing up for each other, something that kind of wasn't really there before this happened, and now everybody's kind of tapping into the resources on their doorstep and really realising, hold on, community power is very empowering.
Yes.
And that's what WCN really stands for, is Community Empowerment Network and stuff.
Brilliant.
And so the events that they've put on is one of the key ones that they do each year. It's called Heal Our Broken Village, HOBV, and I think it's to my understanding that maybe you've kind of heard of that. So if you could tell us a little bit about how you come to hear about Healing Our Broken Village, and what you kind of thought about what it is that they're kind of trying to do there and what they are doing.
I think it's exactly that. It's we are identifying what is available in our locality or in our community. We don't, it's great to get support from outside that, but actually we often look for an answer which is staring straight at us. And if we can find that, then not only is it, it doesn't cost a great deal, B, it's more likely to be sustainable because it's someone who is organic and understands the local area, and also they're more likely to go that extra mile to make it work, because it's not seen as a chore. It's seen as it's seen as our community and something which I want to improve myself. So I think it's really, really important, really, really key, and the lesson to all of us actually that actually we often don't need to think too much outside the box. We often hear this phrase, think outside the box, and I think we need to think inside the box. And actually, once you get your box, sorted, or once you've really, worked out what's in your box, then I think your answer's there. You build on your basic principles, and that is where we can drive things forward. I think we often try and, think too cleverly about something which doesn't need to be. Just, and I think what a community empowerment is effectively that. And I was really impressed when I came to the event last year, and to see everyone coming together, sharing their stories, and listening to what has been done. So I think that just emphasises why it's needed, even more so in peacetime, as it were, when there's no COVID, but also during a crisis time when we need to look after each other and also deliver things. So I think even when we sort of come out of this, hopefully we can build on that and strengthen it even further.
And coming out of that is a word that so many people are like, when is it going to happen? For yourself, what do you hope is going to come out of this? Obviously it's highlighting so many things, professionally and personally and stuff. What do you hope is going to kind of maybe stay or kind of go after this? What do you think? What would you like to see change for the better?
What does it change? So I think from a personal level, I think, you kind of realise what's important to you, don't you? You kind of, it's a life-changing event for all of us. It happened once. I'm in my 40s now, and, I've never experienced anything like this. And touch wood, I won't again. God knows what will happen in the next sort of a few decades. But so I think for a life-changing event for me is, what's really important to you and your family and your communities, which you may have lost touch with your friends, and things like house party or FaceTime is actually really key. Connecting with others, and I think making time and spending time doing that is really important. I think new ways of working as well. I think we often put things off, or we put barriers in the way for why we can't get an objective done. But in a crisis, it's like, what, we haven't got time to think about this. We've just got to do it. And a good example of that is, we're now telephoning everyone over the phone when we speak to patients. We're not seeing them face to face, obviously, because of obvious reasons. So we've had to adapt that. A lot of healthcare have been resistant to that, calling patients up and also doing consultations through the phone or video consulting. And now that's the norm. That's almost taken 2-3 years, to get this suggested as an idea. And even though that's the future, we're now doing it as part of normal practice now. So I think some of those new ways of working, which could really help support our individual patients, is really key. Digital, I think, is a good way of enhancing that. I think a lot of people are doing Zoom and MS Teams, which are able to make meetings happen. So actually, it's put things in a new light, and I think we've evolved in that way. So I think for me, it's a number of those things is appreciate what you've got, identify what your resource is, empower your community, because they're really where our real treasures are. I think we often think there's other treasures, but actually your real ones, the ones we've got close to us.
And kind of lastly, is there any kind of resources out there that you think that may be helpful that you can suggest here for obviously your local community, or any other things that can go out there that people can get in touch?
So I'm having my details to be published. I'm on Twitter and Instagram. I think the NHS websites are generally very good. I think obviously the network, which the Wandsworth Empowerment Network, has a whole heap of resources as well. I think it's identifying your local voluntary sector, your local group, and finding some of those connections which will help you. Public Health England also will have some interesting resources or helpful resources as well. So I think a variety of those, and I think it's important to stay connected with each other and also what's happening. So yeah.
Thank you so much for your time, and
you're welcome.
Yes, carry on with the great work that you're doing, and hopefully we're all going to come out of this soon, as you said. So thanks for the work that you're doing, and take care and be safe.
You're welcome. Same to you. Take care now.
Thank you.
Bye-bye.
Bye. So that was Dr. Mohan Sekeram. Thank you so much for your contribution here. We will leave any suggestions that he did in the dialogue box below. If you have any comments, tips or suggestions, then please leave it down below also. Alternatively, if you want to contact us, then please do so on info@wcen.org.uk. We also have a website. Please make sure that you sign up to the newsletter as well to find out the latest that's happening, and subscribe to the podcast shows and everything else on www.wcen.co.uk. And if you want to find out the latest healthcare guidelines and the latest government information, then please go and check out www.gov.uk, or alternatively, you can check out www.wandsworth.gov.uk. Thank you. If you found anything useful in here and you think you can share it with somebody else, then please do like, share, and subscribe. And we'll see you on the next podcast. Please stay safe and stay well. You're listening to the WCEN podcast.